Good afternoon, everyone, and welcome to our town hall, Zoom town hall on senior citizens issues. I'm Councilman Rory Lantzman from the 24th Council District, and a couple of differences this town hall. This is our fourth town hall. You'll notice that I'm sitting in my office with my plaques and banners and as we say in my neighborhood, my tchotchkes, all behind me. And we're very welcome, grateful for all of you who are joining us. And we're particularly grateful for our panelists. We've got a great group of experts this afternoon to talk with us about issues affecting senior citizens in the coronavirus. I'm very proud to represent the neighborhoods of Kew Gardens Hills, Pominock, Elective, Fresh Meadows, Hillcrest, Jamaica Estates, Briarwood, Parkway Village, Jamaica Hills, and Jamaica. Now, as I said, this is a town hall on senior citizen issues. So we have a number of senior programs in our district. Just by way of example, we have, first of all, Shelton Houses, which is a NYCHA development, a senior NYCHA development in my district. We have, of course, their senior club. Pominock, the other NYCHA development in my district, has a senior center, and we're joined by a representative of Queens Community House, which runs that senior program. We have a senior program at Hillcrest Jewish Center, the Rosalind Gold Senior Center, a senior program. The Young Israel of Hillcrest, the Young Israel of Queens Valley, the Young Israel of Jamaica Estates. Those of you who are joining from those senior programs, welcome. And of course, we have a senior program at the Jamaica Muslim Center that we fund and help found, run by India Home. And the Queens Public Library has its own senior clubs. And I'm sure I'm neglecting to mention a few, but if you are a regular participant in any of those senior programs, just know that you're welcome, and this program, this town hall, is for you. As I hope you know, we're doing the best that we can to continue serving our constituents and keep everyone up to date. My office is open for business, virtually, that is. I'm the only one who's actually been in my office, I think, in the last 6 weeks or almost 2 months. We actually closed the office a little bit early. We were ahead of the curve, we're proud to say. But my team is working all day, and if you reach out to us, we will be able to assist you. You can call us at 718-217-4969. And Sam, if you could put up the information for those who are following us on Zoom so that they can see it. You can call us at 718-217-4969. Sam, that's the panel for people who want to ask a question. There we go. You can email us at rlantzman@council.nyc.gov. You can tweet at us at Rory Lantzman, or you can send us a message via Facebook. So we will put this information up a couple more times during the course of the town hall, so you have an opportunity to write it down. You can also go to my website, which has an archive of our previous virtual town halls on education, on health. We had a meeting with town hall with my staff so people could understand the services that we're able to provide, and also to get a range of COVID-19 information. Also, I hope that you are all getting our regular daily email blasts, which are very informative. You can get on our email list by emailing us. Again, it's rlantzman@council.nyc.gov. And you can get our daily emails so that you can know what's the latest with what's going on in our city. Sam, now is the moment that I know everybody has been waiting for. and that is today's smoothie. Sam, let's show them the smoothie first. They've got to see the smoothie, and then once they see that this is today's smoothie, prepared for me by my beautiful wife, Sam, my beautiful wife. Sam's not my beautiful wife. He's a wonderful husband to somebody. There she is. Today's smoothie made by my beautiful wife is a mix of banana, apple, spinach, mixed berries, and oranges. She slipped in the spinach, my wife, even though I'm not a huge fan of the vegetables. But that's love, ladies and gentlemen. So we are, of course, particularly concerned about how our seniors are doing during this crisis, this pandemic, this awful situation that we find ourselves in. We're concerned about them feeling isolated, their financial insecurity, hunger issues, getting access to food, difficulty accessing public services. These are things that are always a challenge for our senior citizens, but that is particularly true right now. New York City residents who are 75 and older make up a majority of the COVID cases, hospitalizations, and serious outcomes in our city, followed closely by 65 to 74-year-olds. It's a horribly sad reality that our nursing homes have been among the hardest hit by COVID. And we have some really good, excellent nursing and rehabilitative care facilities here in Queens, and we're going to hear from one of them. And you know, we're of course extraordinarily grateful for all the noble and loving employees and volunteers who work with our seniors at tremendous risk, and in some cases have, as a result, contracted the coronavirus themselves. So joining me is our representatives from the Department for the Aging. I believe we have Eileen Malarkey, who is the Assistant Commissioner from the Bureau of Social Services for DFTA, Jose Rodriguez, who's the Director of Government Affairs for DFTA, Kim Kessler, who is from the Food Czar team and is the Assistant Commissioner from the Department of Health and Mental Hygiene, Beth Finkel, who's the State Director for AARP, the American Association of Association. We'll get to it. And here's the thing: I just became a member. When I'm 51, I turned 50. I just became a member of AARP. I was so excited. So you'll tell me actually the name of AARP. We have Patrick Pinchnat, who is the Director of Queens Community House, Pominock Community Center. And we have Charlton Ree from Union Plaza Nursing Facility in Flushing. Now, before I open it up to the panelists for them to introduce themselves and to give us their perspective on what's going on, after they do that, we will get to our question and answers. Sam, can you put up the Q&A window, the Q&A panel? If you are on Zoom and you want to ask a question, you will hit the Q&A button or the chat button on your Zoom, and you'll be able to ask your question. If you have called in and want to ask a question, you can reach out to Sam directly. Sam is the moderator of this town hall from my office. Sam's email address is cd24sam, as in Council District 24, cd24sam@gmail.com, or you can text Sam at 347-498-4826. 347-498-4826. Okay, let's get to our panelists. I don't know if Eileen Malarkey from the Department for the Aging is on the call, or if someone else from the Department for the Aging is taking the lead. But Commissioner Malarkey, are you with us?
I am. Thank you for having me on this call.
Terrific. There you go. I see you. Welcome. So please introduce yourself. Tell us what you're seeing at DFTA. Anything you think that we should know and be aware of, and then of course, once we get through all the panelists, everybody will have a chance to ask questions.
Great, thank you. So I'm Eileen Malarkey. I'm an Assistant Commissioner for the Bureau of Social Services. I want to say a few words about Department for the Aging in general, and then about some of the things that our programs have been doing during COVID-19. So our mission at DFTA is to eliminate ageism and ensure the dignity and quality of life of diverse older adults. We also work to support caregivers through service, advocacy, and education. And we accomplish these goals by partnering with hundreds of community-based organizations to provide services through senior centers, NORCs, case management, home care, home-delivered meal, mental health programs, friendly visiting, and so much more. So social engagement and wellness has always been an important component of our programs, but this has been amplified due to COVID-19. So our programs have really pivoted from direct service at a site to be able to offer services remotely. For example, there's a lot of focus on wellness and reassurance, checking calls to see how people are managing. Do they have adequate food? Are they able to get their medication? Safety issues, and of course, social connections and coping. Our senior centers in the network, our case management agencies that work with homebound clients, our naturally occurring retirement communities, all reach out to members to do these kinds of wellness calls. They connect clients if they need services. So the connection is very similar to what they were doing if somebody would go to a site. We also have geriatric mental health programs in many of our senior centers. They have switched to providing clinical services over the phone and also offering some services remotely. We have caregiver and social adult day programs. They also remotely are providing services, support, respite, connecting caregivers to services, offering virtual support, groups, training, specialized activities. It's very robust kind of offerings. Our friendly visiting programs have gone from once a week in person to twice a week phone calls or visits virtually. And that's for older adults who are homebound and connected to our case management program. And then I also want to mention very important service is home delivered meals, which is a daily meal to seniors, and that program has also continued. So that's a quick snapshot of the ways that these important essential programs continue remotely.
Excellent. Thanks very much. Is there anyone else from DFTA? I mean, I don't know, Jose, if it's something you want to add, or you're just available in case we run into some gaps.
Yes, absolutely. No, I'm just here to assist in any which way I can and help Commissioner Malarkey. I want to say that prior to the pandemic, there's a network of nearly 300 senior centers and satellites and social clubs serve daily meals, usually lunch Monday through Friday, to a daily average of 21,000 older adults in New York City. When centers closed, we quickly transitioned to our direct meal delivery system that would deliver 5 meals to our senior center members' homes every week. As that demand quickly grew, I should say, older adults who had not used our meal program were in need. We enrolled new participants in a period of about 3 weeks, and those served by this program grew more than 75%. And, you know, in the last few weeks, more than 500,000 meals have been delivered, more than that, I should say. The demand continues to grow, and while DIFTA's direct meal delivery system has now been merged to get food, I just wanted to give that sort of outline and perspective. And anything food related, obviously, will be spoken by Kim Kessler.
Yeah, good segue. Food security is a very, very big issue. We in our district, just so people know, we have, in addition to regular food that's available through pantries and through the city's official program, we have 2 kosher food locations. We have halal food distribution locations. And so Commissioner Kim Kessler from the Department of Health and Mental Hygiene, from the Food Czar team, introduce yourself and tell us what we need to know.
Great, thank you so much. Yes, my name is Kim Kessler, and I am an assistant commissioner at the Department of Health. I'm currently working with the food team and here on behalf of the Food Czar team. Mayor de Blasio in mid-March, recognizing the great challenge that COVID-19 would present in terms of food access issues and also food supply issues, appointed Commissioner Catherine Garcia to be the city's COVID-19 food response food czar. And under that mandate, she's been leading an effort to both work across the city to ensure that our food supply is strong and address those supply issues. And then I think what is of greater interest for today, also make sure that we were meeting the needs from an access perspective. We know food security, as has already been talked about, is a big issue in New York City even before this emergency, and now we're anticipating, and we know well that that need is growing. And will continue to grow as we deal with the economic impacts of COVID-19. And so with that in mind, the city's really mobilized all of its resources to meet those needs and stood up a variety of programs, one of which is making meals available at schools all across the city through a grab-and-go meal program that was initially for youth, but then adults were added, and that is now currently at over 450 sites across the city where anyone can go. There's no need to show any identification, documentation. Anyone can go and pick up 3 meals a day for youth and adults. We're also working really hard to shore up our emergency food supply system and the emergency food providers that are always so essential to food access issues in New York. But I think especially now, those pantries and emergency food resources that can remain open, the city is, and the Food Czar team is working to support those places, provide link up to volunteer resources where they can learn about the challenges that those sites are having, and then make sure that people are aware of the benefits that they may be eligible for, link them to the ability to sign up for SNAP, to find out if they're eligible for cash assistance. And then finally, for those who really have no other option and need to have home delivered meals, we have the emergency food home delivery program, which means that for people who are COVID vulnerable, they may be seniors or they may have medical issues that mean that they can't go out. They don't have anyone at home or a neighbor who can pick up food for them. They don't have the ability to order in or get food delivery. For those folks, we want to make sure that there's an option, and that's what the emergency food delivery program is about. And as Jose mentioned, we've been working over the past couple of weeks and really effective this week to merge and bring in together the effort that DIFTA started for its transition of its congregate home delivered meals into this broader emergency food delivery program. And as of this week, the emergency food delivery program is adding more meals so that people who are in that system will be getting deliveries twice a week, and it's food for 3 days. And we are going to continue that and just continue to build out what we need to do to meet the needs of New Yorkers all across the city. So I'm happy to talk about that further as we go along in the meeting.
Terrific. Thank you very much. I'm just going to mention that we also have Persephone Tan, who is the Legislative Affairs Representative from the Mayor's Office, on the call. If I'm not mistaken, Persephone, you're just here to, again, in case there's some gaps that need to be filled in, you might be available to take some questions. Excellent, a thumbs up. All right, so next we're going to have Beth Finkel, the State Director for AARP New York. Beth, welcome. And let's start with making sure that everybody, including AARP members, know what AARP stands for.
First of all, I want to thank you for being one of our newest members, Rory. And I also want to say that your district holds a special place in my heart. Two of my aunts lived on 168th Street, right off of Union Turnpike. I think that's in your district, right? And
That's not only my district, that's 4 blocks from my house.
okay, well, my Aunt Rosie and my Aunt Marilyn lived on that block, and one of my aunts and uncles also lived in Pominock, so very rooted in your neighborhood, although I grew up across the Van Wyck and the Grand Central and Forest Hills. So anyway, I'm very happy to be on today, and I really want to thank everybody on this call. I've talked to a number of them already, and I know the hard work that they're putting in to try to make sure that older New Yorkers get all the services that they need. And I don't think we can thank all of you, and you also, Rory, obviously, for all the hard work in such a totally tragic situation. So thank you, thank you, thank you. In terms of AARP, this is always a funny thing to say, but about, I don't know, 25 or 30 years ago, we changed our name, kind of like IBM and AT&T. So we're just AARP. And the reason is we were the American Association of Retired Persons, but more than 40% of our members are working. Our membership starts at 50. So I think there are very few people who can retire at 50 these days.
So you changed the name. I didn't get it wrong. You changed the name.
Yeah, we changed the name many, many years ago to just AARP. So I always am kind of embarrassed when people say to me, so what does it stand for? And you have to say, no, it doesn't stand for anything, because that's far from the truth. AARP, with almost 38 million members, we're out there advocating every single day for the quality of life for 50 plus and their families, which is why I'm happy to be on this call, because we represent the consumer side. So again, the hard work that all of you are putting in for services, all the senior centers, everyone, we can't thank you enough, because without your services, our members and their families can't age with dignity, which is really what we're all about. Anyway, so just a broad stroke of what we're doing. Sam, I gave Sam a link to our website that really has everything on it, both the resources that AARP has, but also a lot of the state and city resources and federal ones. I know that we're going to be talking about nursing homes, but I just want to say that we put out 6 questions that family members need to be asking nursing homes. And I just think, if you don't mind, I'd just like to hit on these 6 questions, because I think it's really important.
Please do.
Is that all right? So first of all, right now we know the governor changed the rules in terms of reporting on COVID, so that if you're a nursing home that has 5 or more deaths, then they will report the name of the nursing home. And you can find out if a nursing home in your community has 5 or more deaths. So that's important to find out, but it's also just as important to call the nursing home that a loved one is in and say, are there any cases? And also, are there staff people who might have come down with the virus? And these are things that people need to know. Then we
Beth,
also—
can I just interrupt for 1 second?
Sure, Charlton, thank you.
Yeah, you know, it's very easy to come up with these questions on the outside when you're not on the front line. You're going to have family members call and ask if there are any staff members that have been tested. There are a lot of skilled nursing facilities that have been trying to get enough tests from labs, certified labs from the state, just enough tests to do our own residents.
Absolutely.
And they just have gotten inventory, some labs, not all labs, to be able to test everyone in a facility. These facilities average a 280 and up, okay, in terms of beds. And it takes time. It takes people on the front line to draw the blood in full PPE gear. It takes patience. and it takes even longer to get the results. And on top of that, you have 3 shifts that are 24 hours a day, and we're trying to get enough tests just for our residents, and you want us to provide the public with exactly what the numbers are. We're still working on that.
So Charlton, Beth,
Yeah.
Beth,
You know, your line of questioning means well, but it's unrealistic.
Okay, so
everyone, we do have the godlike power to mute whoever we want.
okay.
Don't,
So let
don't,
me
don't let it go
clarify,
out of my
Charles.
head. So listen, we're not doing a debate here. There are different views, and it's all very interesting. Let's let Beth finish her presentation, and then Charlton, you're next. We really want to hear from you, and then in the course of the conversation, we might hear different perspectives on things. So Beth, go. Let's finish.
Let me just clarify, because I did not ask, although it would be nice, and we agree, and we just sent a letter to the governor yesterday asking for more tests and more PPEs to nursing homes. So Charlton, I absolutely understand what you were saying, but that's not what we're asking people to call and ask. We're asking them to find out if there are cases, and we're asking them to find out if there are cases of patients. We didn't ask the numbers. We're asking them if there are cases of staff and patients. We're not asking for numbers, and we're not saying, are you testing everyone? Absolutely, you're right. We understand that limitation, and that's actually one of the #1 things that AARP is advocating for. We couldn't agree with you more, and we're working very closely with Leading Age and many other representatives statewide of nursing homes. So, and 1199 also, by the way. So agreed. So let me go through this a little faster. So the next question is, does the nursing home have enough PPE? And the reason why we're asking that is so that we can go back to the governor and to the federal government and advocate to get more PPEs into nursing homes, because we know that it's not safe, and for the valiant efforts of the staff people that are there. We're also asking about, can you get connected to your family member? Can you have a virtual visit with them, either via iPhone or FaceTime? And then how could that be orchestrated? And then how can you check in and find out how your loved one is? So these are all, I think, just common sense approaches when you're removed from your loved ones and you want to do the right thing by them, and at the same time have the greatest respect and admiration and support for all the nursing homes across New York State. So I thank you. So that's that part. I'll just briefly say one more thing, that the other thing AARP is working strongly on is around fraud right now, because we know that seniors are always the #1 victim of fraud. And we know that in times of devastation like this, the fraudsters really, they come out of the woodwork. And where are they going? They're going to seniors who've been saving their money forever. So right now, where people are calling up seniors and saying, I can give you a test, just send me money. I can come in and clean your air vents, because you're probably going to get it from the air vents in your home. There's a myriad of things that people are saying, and we have to remind seniors who grew up to be very, very polite, right, to anyone who called them on the phone. And it's kind of anathema to them to say, hang up the phone. If it sounds too good to be true, someone's making you an offer, hang up the phone, because that's the way you're going to protect yourself. So I've got a number of other resources, but I don't want to take up all your time right now. So I hope you'll come back to me with some questions. And thank you again.
I think we can count on it. Thank you very, very much. So Charlton, now if you could introduce yourself and just tell us a little bit about Union Plaza, and tell us what you're seeing and experiencing, because you guys are really on the front lines. And I'd love to hear what you have to say. Hold it. Sam, let's make sure Charlton is unmuted. There we go,
Hi.
Charlton.
Yes.
There we go.
Boy, did I really come across that angry?
Not at all.
My name's Charlton Rhee. I'm a licensed nursing home administrator. I've been here at Union Plaza in Flushing since 1996. We are a 280-bed skilled nursing facility. And, we've made an impact in a lot of positive ways to, I think, thousands of lives since then. What I'm seeing now from COVID has pushed everyone, I think, over the edge, beyond the edge in many, many ways. And it's taxing on the staff. It's affected our staff emotionally, mentally. Everyone seems to think that, oh, the nurses in the hospitals have it the hardest. But actually, last time I checked, it's the same licensing agency to become an RN in a skilled nursing facility, an LPN. And we're dealing with COVID cases, and we're dealing with COVID cases that are being sent to us from the hospitals. We're dealing with COVID cases that were not COVID cases, that became COVID cases that we are mandatorily required to take back to our facilities. COVID-19 is a virus that attacks the nursing home population. And, the sooner people understand that, the sooner they'll understand that it is incredibly difficult to contain. It stays on your clothes. It stays in the air. It stays on surfaces. I have teams and teams of people working round the clock to try to disinfect with shoe covers, clean the bed rails, disinfect their gowns, have enough PPE gear. And to your point, there's never enough PPE gear. My facility in particular, we were a little bit ahead of the curve because, we have very, very good emergency management. So we had a lot of PPE gear in the beginning to be able to distribute to staff before the shortages occurred. But we are now at a point where we don't have enough N95 masks. And it's funny, I got an email from the New York City Health Department with someone who was assigned to us from the New York City DOH MH saying that if you need us, we're here for you. I'm your contact. So I said, we could use N95s, and came back, sorry, those are only being given to homes with ventilators. And we said, really? Because, we're giving oxygen. We're also suctioning them. Really, what's the difference? And they said, we'll get back to you. And that was 2 days ago. So, this is what we have to deal with, and we have to rely on donations from the community. We have to rely on donations from politicians to help us get us enough N95 masks just to make sure that our frontline staff who are dealing with COVID patients have the right gear. KN95 is not the same as N95 masks. So to answer your question, we do have some PPE gear, but we don't have enough N95 masks. That's number one. And what we are seeing is absolute and total carnage in nursing homes. It's overwhelming. Staff are scared. They're getting doctor's notes in other facilities as well as ours that say that they have underlying conditions. They can't come. People are scared for their lives, but, we also have a majority of staff that are coming every day, and they're angels, putting themselves at risk and their families at risk. A virus, having a mask and having a face shield doesn't protect you from that, 100%. And yet they come in every day. They're doing double shifts. They're doing the best they can. They're feeding them. They're drawing blood. And they're trying to maintain and keep those that are healthy, and attend to those people that are really, really sick. So I'm not quite sure, you tell me how much time these staff members on the units have fielding your questions that you're asking them to ask. That's why we're posting everything. And all this data that you're talking about has already been given to the state. And I think that at some point, some of the agencies need to get involved and instead of over-regulating us, help us in getting the right information out. Since day one, we've been filling out surveys with the state by 1 o'clock, answering their questions. How many people do we suspect have COVID? How many people do we think have died from COVID? How many people have gone to the hospital that we suspect had COVID. And ever since the fiasco with the governor online, they've changed their line of questioning. So now we have to do that as well by 1 o'clock. And now there's a federal survey. Now there's an infection control survey. So now we have all these added other requirements, taking away from our ability to be able to care for people and provide them with the help that they need. And it's taxing, and it's especially taxing on the nurses that are here, the nurses that care, and the nurses who are on the front line. So I'm not very, very fond of additional questions. I'm putting myself at risk. I lost my mother last week from COVID, but I still gear up and I put my PPE gear on and I take a cell phone and I try to make arrangements to do telemedicine, and I also try to make phone calls with family members. But when you have X number of COVID patients, of course, family members want to be there and see them. I'm putting myself at risk. I do it, but I understand it's really important to have that ability to do it, but we can't do it 24 hours a day. And family members and other agencies and people from the outside don't understand that every time that you do that, you're putting someone else at risk to perform these little acts that are, families' rights and so on and so forth. So, you just understand that everyone's under an incredible amount of duress. And while it's easy to be on the outside looking in, you have no idea what it's like on the front line. And you have no idea how it is to try to convince staff that it's going to be okay, that, it's going to be all right.
Charlton, thanks for sharing that, and thanks for giving us an opportunity, or at least a glimpse virtually into what.
Sorry, I wish I could be more upbeat about it, but it's pretty bad. We need your support. We need N95 masks. We need to be looked upon as part of the front line, because that's what the nurses and doctors are going through. They're coming in, they're gearing up in full suits, they're giving care every day, they're putting themselves at risk as well. And, it's just not fair to overregulate us or to assign us people that are useless, from agencies that say that they care and can't do anything for us because of policy, or someone up the chain has made a decision to give N95 masks to skilled nursing facilities that only have ventilators. It's unhelpful.
Mm. All right, thank you.
Sure.
Patrick from Queens Community House, the Paumanok Community Center, welcome. Why don't you introduce yourself and tell us what you're seeing as a direct service provider to seniors in our community.
Thank you, Council Member. Thank you for all your support you give our organization, Queens Community House, and also Paumanok Community Center. Also, thank you to all the panelists that are here on this virtual town hall. We're on the front lines as well with our food pantry, but I'll start off with what's transpiring with our senior center. So I'm simply on this call to figure out other ways that we can strengthen our coordination so we could better serve all of our participants. So some seniors who have regularly had lunch at our center are still not receiving meals. Our senior center has sent in approximately 80 names to DFTA before they closed registration for people needing meals. Only half of those seniors receive meals. We do get confirmations on a weekly basis from people who finally do receive deliveries, but there are many more awaiting delivery. And this is a huge challenge, and they're reaching out to us. And so we're trying to find out ways we could strengthen that coordination and ensure that everybody's receiving the deliveries and we're better, and we're providing that to them. So that's what we're seeing on the ground. There's need, as has already been addressed on the call from other panelists. It's a huge need, and we want to make sure that we're there for everyone. So I guess I'll stop there.
Okay, thank you. Let me just ask a couple of questions while we queue up the questions from our viewers. So Patrick, how many people usually attend the Paumanok Senior Program, and do you know if there's any virtual program, whether it's phone calls or Zoom or whatever, the participants would be able to do? Like who's checking up on them? Is anything going on with that universe of people who would, at this time of day, probably be at the Paumanok Senior Center?
Yes, thank you, council member. So yes, our senior center serves, I would say, anywhere between 80 and 100 older adults. There are days when that number fluctuates to even more, higher number. All of our staff are currently doing wellness checks with all the older adults. That happens several times throughout the week. I'm following up with them in regards to just overall, what are their needs? We're calling it our COVID-19 needs assessment wellness checks. So what are their needs? What would they like us to look into? So different things have come out in that conversation. For example, some seniors have seen in the news, the mayor made an announcement, I believe, about tablets that are going to some seniors in the city. So some of the older adults have asked us about that, and we're looking to find out more information about how we can help them secure a tablet. So it's different things like that that come out in the wellness checks. But that happens several times throughout the week. Our senior center staff reach out to older adults. Currently, we're not doing any particular activity with them. We are looking to do some more virtual activities. But again, a lot of it is really centered around food at this point. Food and how they can communicate via a tablet with their loved ones.
Thanks. Commissioner Kessler, so Patrick had raised the issue of food. If you're a senior at home or a family member of a senior and you're used to them getting their lunch at the local senior center, how do we make sure, how does someone make sure that they or their mom or dad is getting, a meal every day?
Yeah, it's such an important question, and I want to respond to what Patrick raised because it's a big priority for the Food Czar team to make sure that nobody slips through the cracks. And so what we've done, Patrick, in the last week is the city's created what's called an authorized enroller program, which is new. And we see that the senior centers are so well positioned and such an important asset in terms of meeting senior needs. And so the emergency food delivery program that I mentioned earlier, which is our system for providing home delivered meals, previously the only way to enroll was to call 311. That is still an option, 311, or visiting our website, nyc.gov/getfood. But now we've also created a mechanism, authorized enroller system, so that senior centers will be able to enroll seniors into that meal delivery program. And Patrick, your senior center hopefully has received an email from the Food Czar team inviting your team to come and become trained in that program. Trainings are happening this week and next week, and happy to follow up with you offline about that, but it creates another route for seniors to be able to get signed up into the program. Any seniors who previously were already receiving meals through the program that DFTA started will continue to receive those meals, and they do not need to sign up again. The only, the main change will be that they'll receive more meals because we're moving to a twice a week food for 3 days delivery system. And it will be more meals per day. So those are the main changes. The authorized enroller program will allow senior centers to be able to see who's enrolled in the program and when their deliveries are happening. And we hope that that will help seniors to be able to get food and talk to their senior center if there's an issue, and then we have paths for customer service to address issues that come up. Hopefully that's helpful.
Thank you.
Thank you.
All right. So I know we have a question coming in from Zena Zimmerman. I have 160,000 constituents, but Zena is one of my favorites. So Zena, Sam, can we get Zena in the queue?
Hi, can you hear me?
Yes, we can. Just speak up, big, strong voice.
My name is Zena Zimmerman, and Rory, you're one of my favorites as well. I have a two-part question, and I'll take the second part first because it's more important. Rory, as you know, I get involved and I try to help out wherever I can. There seems to be a lot of seniors in my neighborhood, the ones that I'm familiar with, that could be getting services of all sorts. And I'm wondering what you would suggest to be the best one-stop shop because a lot of them don't feel comfortable reaching out. They're embarrassed, they're ashamed, all of the above. So what would be the best one stop? And actually, I would like personally to volunteer to do phone calling to seniors because I'm autoimmune, so I can't really go running around outside. So I'm looking for one stop that might provide counseling, food service, all the different things that seniors need. And the second part of my question is, I had gone to rehab when I had my knee and hip replaced.
Zena, let's do the first part.
Okay.
Yeah, and then we'll get to the
Okay.
second part. So who wants to take a crack at that Zena's first question?
Rory said, he had to mute me and then he put me back on. He said, Charlie, what's your name?
You've all been unmuted, so just speak up.
This is Eileen from the Department for the Aging. I'm going to give you two replies. One, we have something through the Department for the Aging called Aging Connect, and the phone number's 212-244. Sorry, too fast?
Yeah, I'm old. Okay.
That's
Aging
okay.
Connect. Go ahead. What's the number?
212-244. 6469.
And this is the Department of the Aging?
Yes, it's called Aging Connect.
Okay.
And staff really have an expertise in the kinds of resources that are available in the community
Okay.
and can connect you. The other thing I was going to say, I wasn't sure if you were also saying you wanted to volunteer.
Yeah, so Rory can tell you that if I offer, I'm serious. So I would like to volunteer to do phone calls, things like that I can do from home because I'm autoimmune. So I really don't want to go out and, do things like with food and pack things. That's probably not a good idea for me. So I'd love to do some phone calls and call people, see how they are, see if I can help them, because I'm pretty good at that.
Okay.
So if somebody would like me to, take me up on it, I'd be glad to.
I really appreciate that offer. And Queens Community House, who's on the phone, actually has a friendly visiting program, and they have also other volunteer opportunities. So I'm wondering if we can connect you to someone from Queens Community House, so you could talk offline on what's available, what would be a good fit. And I really want to appreciate your giving and wanting to do that. Thank you.
You're very welcome.
Patrick, put Zena to work.
Yes, thank you, Eileen, and thank you, Councilmember. Yes, we would love to be of support. So what you can do is you can email me. Let me give you my email address. Hello?
Yeah, go ahead.
Okay, it's P as in Peter, another P as in Peter, I, N like Nancy, C, H, I, N like Nancy, A, and T like Tom,
Whoa.
the @ symbol,
Yep.
QCHNYC.org. If you email me, I can then get it to my colleagues in our agency to get you some additional support and look at what we could possibly do regarding friendly visiting.
Okay.
And thank you, Eileen, for that plugging us in with that as well.
Patrick, can I just repeat your email address? It's
Absolutely.
PPINCHINAT @QCHNYC.org.
Yes, and please reference this virtual town hall.
Okay.
Thank you.
And Zena, hi, this is Jose from DIFTA. You can also call Aging Connect as well, and Aging Connect will put you in touch with NYC Service for other volunteer opportunities as well. So definitely use the Aging Connect number as a helpful resource.
Okay.
That's what it's there for. Yes. And also you can access our website.
Okay, because what I'm really interested in doing in a broader sense is putting together something, Rory, like you've been doing, but being able to post it, you know, sending it out to people in the neighborhood and posting stuff. Excuse me, my doorbell is ringing, excuse me.
Okay. All right, good. Let me ask something related, Patrick. Your Queens Community House, you've got lots of different locations. The one that we're talking about now is in Pominock. If I'm a senior in Pominock and I've never gone to the center for whatever reason, I go to a different center, can I reach out to you now and get on the food distribution list? And what if I don't live in Pominock? What if I live across the street and I'm in Elective, which doesn't have its own indigenous senior program? Can they also call Queens Community House, or should they call some other DFTA, the number that maybe Commissioner Kessler was talking about?
Thank you, Councilmember, for that question. So one thing is they can definitely reach out to me, of course, but as pertaining to what I mentioned earlier on, we would need some support from DFTA because, as I mentioned, the registration was closed for people in regards to.
Hold on, Patrick, you got muted somehow.
All right.
There you go, Patrick. You're back.
So yeah, that speaks to what I was initially mentioning about strengthening a coordination, working towards that. So we would definitely have to also speak to DFTA about how we would work on getting the registration opened up and what does that look like for new seniors. But we at Queens Community House on the ground, we also have a food pantry that takes place every Thursday from 10 a.m. to 1 p.m. and from 10 a.m. to 11 a.m. It's a senior center, seniors line for them to get food. That's if they can leave their house. They can also come to the community center on Thursdays and we provide free food. So that's what we could do on the ground in terms of coordinating the registrations and things of that nature. I believe we would need some more support from
And
them.
I just want to follow up on that point because we're working very closely with DFTA, but in going forward, Patrick, for your senior center and all senior centers, the Get Food team, the Foods Our team,
Okay.
will the link for food pieces, and there will be a way that you can enroll seniors. But for any senior, and this is really important, who does need food, they can call 311 and enroll. And 311 has been adding capacity to help to address with wait times, or they can visit the website. But we and the Foods Our team will be working with senior centers to help support the enrollment process, and we're doing that in coordination with
Much
DFTA.
appreciated. Much appreciated.
Good. Thank you. In the spirit of Zena and others who want to have something to do, we have a request from the U.S. Census, who's on the call, for me to remind everybody, fill out your census forms. That's something to do. We did that in my house last week. We put it off for a little bit. It was a fun activity for me and my daughters. And if you haven't filled out your census, you can go online and do that. It doesn't take that long, but it's really, really important. The next question we have, and I know Zena, you had a second one. We'll try to get back to that.
Okay.
But we have a question now from Emma, who isn't able to dial in, or to be put on the speaker. So I'm going to read Emma's question. Hi, Emma here. I am a senior living alone. I feel like I'm about to crack from the isolation, insomnia and nightmares. My goodness. Can someone please set up a chat line for seniors to speak to their peers? Not a helpline or a counseling line, but a, quote, party line to connect with others. That is really interesting. I don't know if our friends at DFTA are aware of such a service or program. Maybe Beth at Aarp, you're aware of something where seniors are able to connect with each other just to socialize and interact. Who wants to take a stab at that?
This is Eileen from Department for the Aging. We do fund geriatric mental health programs at various senior centers, and some of them are have been able to offer support groups and discussion groups. So we could see if there's one that we can connect you to, if of interest to you.
Okay.
That's one option.
All right. Let me say that I gave the number, the detail, the information from my office earlier. Sam, can you put up our information panel? We're going to collect all the loose threads from today's call, the phone numbers that were given out, the emails that were given out, and have them available in my office so that after this call, if you reach out to us, we'll be able to provide you the information. My phone number, again, is 718-217-4969. Sam, if we can get that panel up, there he goes. 718-217-4969. You can email me at rlantzman@council.nyc.gov. You can reach me on Facebook, Rory Lantzman, or on Twitter at Rory Lantzman, and we will get you the information that was given out at this meeting if you didn't have a chance to write it down or make a note. So Sam, who do we have for our next question? Is Carol Blatt available? Oh wait, no, wait, Beth, did I not give AARP a chance to respond to that?
Very quickly, AARP has a new program. It's called Connect to Effect, and it's online at aarp.org. Just put in Connect to Effect, EFFECT, and we are pairing just people in the community who would like to chat with other people. So it's not like a chat room or a lot of people on it, but we're connecting one-on-one people who would like to chat with other people, and so you might want to check that out. And I feel for you because we know, and I know Eileen knows as well, that being isolated is very unhealthy, and that's why you heard the Department of Aging is doing all this work on it, and so is AARP to combat isolation. Being lonely is equal to smoking 15 cigarettes a day to your health. So thank you for calling in and asking, and please do connect with these wonderful services that people mention. It's essential for your good health.
Thank you very much. Okay, now, Sam, can you queue up Ms. Blatt?
I'm right here. Hi,
All right,
I'm right here.
so what is your question?
Well, I have a few, but I'll just ask the first one. In Israel, they've already given out tests to people living in independent and assisted living places to make sure or check whether or not they have the COVID virus. Do they intend on doing this here in New York? I ask that because my mom lives in an assisted living place.
What? Sorry, Ms. Blatt, was the question tests?
Yeah, do they intend on giving the COVID-19 test to the people living directly in assisted living places? They did that in Israel. My aunt and uncle already went through that.
Got it.
Well,
Beth?
just part of the letter that we sent to the governor yesterday from AARP and a number of other partners was not just about nursing homes, but about assisted living and adult homes also.
Right.
So absolutely, assisted living, they need the same protections. It's the same frontline workers that must be protected, and the same thing with the patients that are
right.
in there. So
And my second question is this. Second part of it is an assisted living place is totally different than a nursing home. A nursing home you can equate to a hospital. An assisted living place you can equate to an apartment building. Will there be a provision when the governor or the mayor start to put in place a plan for people to go back to normal about when the, in terms of visitors, when the people who live in these assisted living places can have visitors be let out of quarantine to the point where they can have their children come and visit them?
That's a good question. My mom had lived in an assisted living facility for a while, so I'm very familiar with them. Does anyone from, that's probably a better question for the Department of Health, but maybe someone from the Department for the Aging or the Mayor's Office just happens to know whether or not the restrictions that exist for nursing home and hospital visits
But
fully extend to assisted living facilities, and if so, might those be lifted at some point sooner than hospitals and nursing homes, as at some point we start to come out of this quarantine phase?
I can try. This is Persephone from the mayor's office. I believe assisted living facilities and nursing homes are under the jurisdiction of the state Department of Health. And I think at this place, because this crisis is such a brand new world for everyone, that we continue to follow the guidance of the state and city Department of Health in terms of guidance and social distancing. And I know this is a difficult time, not being able to see a loved one, especially when they're living not with you, but far away, and making sure that this is why we need to do those regular check-ins, especially with older adults, and making sure that, family members do remember to call them, and especially for older adults who might not necessarily have family and friends to check up on them, that there are resources available from the Department for the Aging, which is why we have the Department for the Aging on the line to remind folks that there are a variety of services and programs that are still available and open, but at this point, it is done so remotely and virtually.
Charlton, I want to ask you. I've been to Union Plaza many times, and as well as others that are in my district, nursing homes, rehab facilities, and at Union Plaza in particular, I'm always impressed by how much effort goes in to programming for the residents, for the people who are there, to make their days meaningful and interesting. It sounds glib to say this now, but it's almost like summer camp for older people, the amount of that goes into giving them recreation and entertainment.
Right.
Tell us about the challenges of doing that in the COVID-19 era, and how you guys are doing.
Yeah, one thing first of all, we love you. That's why we love having you come all the time. But people have to keep in mind that, just being COVID positive isn't quite a good description. You have people that are COVID positive that show no symptoms. You have people that are COVID positive that are starting to show symptoms. And then you have people that are COVID positive that are actually in the process of dying from it. So even if you're COVID positive, you have different levels of COVID. And then you have people that are not, that have tested negative. So how do you ensure that the people that are negative aren't going to be infected? And if you're having recreation, how do you make sure, or anything, that a staff member doesn't carry it on them to a person that's not infected? That's the biggest challenge. And, we provide full PPE gear. We try to minimize exposure to those residents that show no symptoms. And then we also try to make sure that we don't infect people that aren't infected. It's a challenge. And whether it's, making sure that their favorite programming is on, that their cable television shows in their languages are on and available, whether it's music that we're piping overhead, even as we speak, for the staff as well as for the residents. It's a real challenge during these days, but the most important thing is understanding and identifying which residents are positive, which ones aren't, which residents are in their incubation stage and are starting to show signs. It's a real challenge, and those numbers change every single day. it's almost impossible, quite frankly. But we're doing our best to make sure that that our staff don't expose themselves and don't expose people that aren't sick. And we're taking a metered approach. So we have a list that we go through after they receive tests, and we submit them, and we go over it with our recreation staff, and we can't do group activities, so we go hallway to hallway and have a strolling minstrel, or we have a young lady that plays the piano and or plays an instrument or plays music. We can't do toss the ball because, as you know, it sticks to surfaces as well. So there are a lot of modifications. There are a lot of things that we do, but our recreation staff does come in every day. And we try to work around that, and we try to provide recreation at a distance. And it's really important to know that, we're trying very, very hard to keep morale up high, both for the residents as well as the staff. And it's taxing. It's really, really taxing. Can you imagine being, a resident here, and this is their home, and they're used to seeing everyone smiling and without any PPE gear. Suddenly you're showing up with a face shield and full on garb, and they don't know who you are. It's scary. So you have to really take a metered approach. What do you mean I can't sit with my roommate in the dining room with all my friends anymore? Well, you can't congregate anymore. So changes are being made, and you have to keep in mind keep the residents' perspective in the center. And it's a challenge. It's a real challenge every single day. And like I said, this is, I don't mean to sound so grim, but the reality is that it's not a flu. It kills people. It's indiscriminate, but it feeds on this population as well as staff members who may have any underlying conditions, and quite frankly, people that don't have underlying conditions. It's a scary time, but people are coming in every single day, and we're trying to do our best to take care of the residents. So. Like I said, if anyone out there can send us some N95 masks, that would be very helpful. Not KN95, but N95 masks. That would be helpful. That's what nursing homes need. We need N95 masks.
Thank you. Got it. Okay, we had a question from Sylvia Sikter from India Home, another institution that's near and dear to my heart. India Home runs the Bessie Senior Center, which we help establish at the Jamaica Muslim Center in my district. Sam, can you loop in Sylvia?
Thank you very much, Councilman Rory Landsman and the panelists, and giving me the opportunity to ask the questions. So as Councilman informed that India Home runs the Senior Center program in Jamaica, and we are also collaborating with Queens Community House in Kew Gardens and in Sunnyside, and the biggest one in Jamaica Muslim Center, which called the Daisy Senior Center. So through DEFTA, we are basically providing the home delivered meals now to 100 seniors. But for the Daisy Senior Center, we have almost 500 to 600 registered members. And now, I'm receiving the phone calls on a regular basis from our seniors, and they're asking for the meals. But currently, we don't have that capacity. More than 100 seniors we can provide the meals, because the contract with our caterer, they have the contract directly with Department for the Aging, and just 100 seniors are getting the meals. But we have 100 to 150 seniors in the waiting list who are really in need of meals. And currently, as the Ramadan started, so the caterer are providing the halal meals during the iftar time. When the sun sets, Muslims basically break their fasting and then they eat. So now I'm receiving a lot of phone calls. So my questions, how can we get more, the contract for the caterer to be bring the seniors in the loop for getting the meals? That's one. And the other concern that we are facing, the caterers are basically sending the meals to the seniors' home, and they're delivering to 100 seniors, and they're going all around the Queens area, mostly in the Jamaica area. And they're asking us, they don't have mask or the enough gloves, you know, like we are really concerned about the safety issues. So if we can get that help from you, that would be really, really awesome, because we don't know like how to help them in that way. Thank you.
Thank you. That sounds like a question for our food czar, or our food czar team member. Is Commissioner Kessler still on the call?
I think she's muted.
Okay, I don't see her video. Sam, could you unmute Commissioner Kessler?
This is Eileen from Department for the Aging. I think there was a few people on the phone that thought this was going till 3, and then there's others that can stay on till 3:30. So I'm not sure if she was one of those people.
Okay.
Are you still there, Kim?
I think we've lost Kim, although her logo is still up, so she's still, I think, connected. But in any event, could either of the other city officials answer that question? And if not, then we will get the information and get back to India Home.
Yeah, we can do a follow-up, Sylvia. This is Persephone. Hi.
Hi, Persephone. Thank you very much for the thing. Like, we are really, really looking forward to that, because, you know, like, we're really concerned about the deliverymen and their safety issues, because they are the people who are going on the ground and delivering the meals to our seniors, and we are absolutely depending on them. So their health should be the first priority right at this moment. Thank you.
Good.
Thank you. We'll follow up.
Thanks.
I'm just gonna do Zena's. We're gonna go to 3:30, and I appreciate everyone who can stay on until then staying on. Zena's second question had to do with elective surgery. I'm going to expand it a little bit. One of the realities of being a senior citizen is you're probably making more regular trips to a doctor for this or that, for chronic conditions, even if they're not serious ones. What advice do you have for people who are concerned about just visiting making their regular doctor visits or dealing with their non-COVID issues? What do things look like for them? Anyone from DIFTA have any thoughts on that?
I'm sorry. Can you say that again?
Sure. The previous caller, Zena Zimmerman, had a question about scheduling elective surgery, when we might foresee that those kind of things that people were expecting to do will be able to do, and then just expanding it a little more for seniors who have to make regular visits to their doctor to deal with the kinds of things that seniors have to deal with. What sort of things should they be thinking through, and how do they get to do those things when everything seems locked down?
This is Persephone. I can take a little bit part of that. I think this is more relevant for the Department of Health to answer. I think at this point, because we are abiding by New York State's being on pause and adhering to the health department's guidance to social distance, and due to the fact that we all know that the hospitals are inundated with COVID patients, those who are positive, those who are in the ER rooms. And this is not my complete advice, but this is based on guidance Department of Health has provided before, which is, call and consult with your doctor. You might not be able to physically visit them at this point because we have to social distance, and also, especially if you're an older adult, is safer to stay home. But if you have something going on with either elective surgery or other things you're concerned about, to do a teleconference with your doctor and consult with them on next steps, and they can advise you on what to do. Obviously, if this is an emergency, and I'm gonna disclose, I'm not a doctor, but obviously if it's an emergency, you know, call 911, don't wait. But, you know, if there's elective surgeries, I would say, you know, consult with your doctor, but I don't think those are happening right now.
Right. Okay. I have one more question coming in, and it's from an anonymous person, so I will ask the question. My normal Social Security income isn't enough. Now that I need to buy all these cleaning supplies, are there any cash assistance programs for seniors? Anyone have any information on that?
What I would suggest is calling the Aging Connect line that I gave earlier, which is 212-244-6469, and they can talk to someone more about the particulars and see if there's a way that you could be assisted.
All right, and we prepared a couple of slides based on the information that was given out this afternoon. Sam, do you want to put those up, and I'll just explain what they are, and then we'll wrap up. Okay, so these are numbers to call if you need help. First, foremost, my number, 718-217-4969. These are displayed on the screen, but for those of you who are on via call, there's the AARP number, which is 888-687-2277. That's 888-687-2277. There's Queens Community House, 718-591-6060, 718-591-6060. And we have the Department for the Aging, 212-244-6469. That's 212-244-6469. And then there are a bunch of websites to go to. If we can get that panel up, I won't read them because they're too long. Actually, they're not long at all. Let's get that panel up. There's my whistling hold music. Here we go. No, back. There we go. For information videos on how to keep yourself safe, there's videos.aarp.org, videos.aarp.org. You can text, call, or chat online with others at nyc.gov/nycwell, nyc.gov/nycwell. And then if you want to get involved with virtual volunteering, there is impactcommunityservice.com. impactcommunityservice.com. And also, in terms of cash assistance, HRA does have a program. So as with anything else, whatever you need, give my office a call, and we will do our best to connect you to the service or program that is available. That is all the questions that we're going to be able to do this afternoon. For those of you with questions that weren't asked, give us a call or an email, and we will get you your answers. And then let me just give everyone an opportunity, give a 30-second closing, parting message to our viewers and our listeners, and we'll start from the administration. Somebody from DFTA or the mayor's office, would ever like to represent, and just say goodbye to everyone.
Thank you. It's Eileen Malarkey from the Department for the Aging, and thank you for having this opportunity to speak with you today and hear your questions, and keep our programs in mind when you need assistance. We're here for you in terms of helping you make the connections, offering volunteer opportunities, home delivered meals, caregiver programs. There's really such a robust amount of programs that are available for you, whether it's reassurance or a different kind of service. So please don't be shy about reaching out, and we'll connect you to one of our community-based organizations that provide these services. Thank you.
Thank you. Beth from AARP.
Sorry, back again. I just want to thank you, Rory, for convening this. It's so important to get this information out. And again, I just want to thank all of the government people on the call and all of the providers on the call for doing just unbelievable service above and beyond for all of us. And from AARP, I hope you go to our website and get the information that we have that can be helpful in these really treacherous times. So thank you for convening it and for getting the information out.
Thank you for joining us. Charlton, want
Yes.
to say goodbye to
Sure.
everyone?
Yeah, I want to thank you, first of all, for hosting this. I think it's important for everyone to know that skilled nursing facilities are on the front line. We're very much so a part of your family and very much so a part of your community. Keep in mind, we're not allowed to discuss a lot with the public due to strict HIPAA guidelines, but people do take pride. We do take care of our loved ones, your loved ones, and we're doing our best given the circumstances. It's not to say that there isn't enough support, but any support that the community can give, including everyone on the Zoom call to your local skilled nursing facility, would be greatly appreciated. And we are doing our best.
Thank you, Charlton, and we're all very, very sorry for your personal loss.
Thank you.
This time, Patrick, you get the last word as a panelist from Queens Community House.
Yes, thank you, Councilmember Lanceman, and thank you to your whole office. Thank you to all the prestigious panelists that are on this town hall, and a huge thank you to all the essential workers out there throughout Queens, New York City, and the whole country for your service. We are greatly, greatly appreciative of all of that. Also, you can log on to our website for our organization, Queens Community House, at www.qchnyc.org if you would like to know more information about how we're servicing the communities here in Queens. Thank you. Stay strong, be well, and safety to all.
Thank you very much. Thank you all our panelists. I really appreciate you taking the time this afternoon. I know all of you are incredibly busy and trying to do the best that you can for us. We thank everyone who called in or Zoomed in. We will have our next town hall meeting information out as soon as possible. You can see on the screen right now how you can reach my office by phone, 718-217-4969, by email, rlanceman@council.nyc.gov, Facebook, facebook.com/Rory Lanceman, Twitter @Rory Lanceman. You can go to my council website. We have a special COVID-19 page. Thanks again for everybody for participating in this town hall. I wish everyone a safe journey through this crisis, and hopefully we'll see each other and be together in person very soon. Thank you all. Good afternoon.
Thank you.
Thank you. Thank you.
Thank you.